कितना बजे सुबह होने वाला है? इनका कितना बजे सुबह होने वाला है?
इसका 2 बजे।
मिला मिला और औसत दिया और आए क्या तो मांग रहे कौन सा कितना है ना कल कितना है ना हाँ कल बहुत से 4 बजे तक है चल ठीक है उधर चलिए एक का शॉप है वो ठीक है और पर्सनली भेज देंगे ग्रुप में देंगे तो और भी बहुत सारे लोग हैं जो देंगे क्या करेंगे अगर अभी नहीं भेजा होगा
Please share the first session PPT also if possible. Yes, please. Share first. I missed it, sir. Will it be possible for you to provide it here?
क्या करें सर
Kindly provide the link for the feedback form. Feedback form ఇప్పుడు ఎందుకు ఇస్తాను కదా అప్పుడే అయిపోయింది కదా हम तो 1 बजे को क्लोज कर दिया और 100 से ज्यादा आ गया हो गया हाँ बस अंते it is not possible right now.
सॉरी इन्फॉर्मेशन का
ऑलरेडी लिंक was disabled sir, disabled मैडम बोल के रख दीजिए बस.
ऐसे इंडिविजुअल के लिए हम कंसीडर नहीं कर सकते ना, अपने भी बहुत सारे लोग आएंगे.
टाइम बोला तो टाइम ही छे. బాబు ఫోన్ చేసినావా ఇంతకుముందు? అప్పుడు ఈ గిన్నెలు కడదాం అన్నట్టు పోయినా. ఓకే ఓకే, ఏం కాదు, మళ్ళీ వచ్చి కలవలేదు. ఏమైతే ఏం లేదు, అంతకుముందు మీటింగ్ కోర్స్ నోటిఫికేషన్ సార్ కదా, అది
Hello,
చేసినారు లేదా
dear participants.
మేడంకి ఒక హార్డ్ కాపీ ఇవ్వాలి. అట్లా
In 10 minutes, we are going to start the FBP.
దానికోసమే పెట్టారు. అందాజ ఒక్కొక్క సబ్జెక్ట్కి ఒక్కొక్క తీరంగా ఉంటాయి కదా, దానికోసమే ఆమెను కలిసి అప్డేట్ ఇవ్వండి. కలిసి రెడీగా ఉన్నాయి మేడం, పంపిస్తా అని చెప్పండి. కలిసి సరిపోతుంది.
Good afternoon, Madhavi madam. Can you hear me, Madhavi madam?
Sir, hear me. Yeah, yeah.
हम खाएंगे.
Hello. Audible.
Hello. Can you hear me?
Yes, sir, we can hear you, sir.
Okay, right.
Yeah,
So, how many joined?
sir, as of now,
13 plus 2, we have 15. Am I right?
yeah, sir, around 18.
Okay.
Sir, yeah, 10 more minutes are there, no, sir?
టీవీ రెడ్డి సారు మాట్లాడుతుండు, మాధవి మేడం అంటుండే. అయితే మీకు చెప్తాను.
Good afternoon, Dr. Venkateshan, sir.
I think he's in the mute, sir.
Am I audible?
Good afternoon, sir. Yeah, you can.
Good
You
afternoon.
are audible, sir.
Yes, thank you.
Yeah, good afternoon, sir. Venkateshan, sir. Dr. Venkateshan, good afternoon.
Good afternoon. Yes.
Okay. Good afternoon, everybody. This is Dr. T.V. Reddy, Vice Principal, now Gross Clinical Engineering, Hyderabad. I welcome you all to this National Faculty Development Program on natural and synthetic bionanomaterials, preparation and applications in tissue engineering, drug design, and cancer therapeutics. Malla College of Engineering was established in 2005 under the aegis of Malla Group of Institutions by legendary Sri Malla Garu. MRC commits itself for the highest form of education. It thoroughly depicts the professional requirements of budding engineers. MRC facilitates platform for schools aspiring CSC, AML, DS, and ECE, while providing students with a state-of-art technical skill. MRC provides holistic development students to make them technically and physically strong engineers. You all aware, very active research is going on around the globe on the nanomaterials. In recent years, these materials emerged in modern medicine. There are a number of applications in optical imaging, MRI, drug delivery, and so on. This is useful to understand recent trends related to nanomaterials in modern medicine. Thank you, Dr. J. Accept our resource
Thank you,
for
sir.
this program. However, Dr. introduce the chief guest and the resource person, Dr. J. Venkateshan, sir. Over to Madhavi, madam.
Thank you, sir. Thank you, TV Reddy, sir. Good evening, all of you. Myself, Dr. Madhavi, Associate Professor, Malla College of Engineering. My hearty welcome to all the participants for the one-day online FDP on natural and synthetic bionanomaterials and its preparation and application in tissue engineering and drug delivery, which is related to the cancer therapeutics, which is by the Dr. Jayachandran Venkateshan sir. And now I'll take it is my honor to introduce the sir and our honorable speaker, that is Dr. Jayachandran Venkateshan, MSc, MPhil, PhD, who is currently working as an assistant professor at Enepoya Research Center, Enepoya, which is a deemed university located in the Mangalore, Karnataka, and is also a research professor at Hanyang University, Erika, which is in the Seoul, South Korea. He worked as a postdoctoral researcher in the division of bioengineering at the Incheon, that is in the National University, which is located in the South Korea. In addition, he worked as a research professor at the Department of Chemistry and Marine Bioprocess Research Center at Pukyang National University, South Korea. He received his master's degree in chemistry from Tiruvallur University in 2005. He also received his PhD from Pukyang National University in 2011 from South Korea only. His primary research interests include investigating and developing the materials from marine resources for biomedical applications. Furthermore, his research includes the investigation of natural biomaterials for tissue engineering and drug delivery applications. He has published more than 250 research papers with an H index of 50 and holds 4 patents. Now we are getting that is we are having the FDP on the this natural and synthetic biomaterials preparation and its applications, which includes that is the bionanomaterials have gained a considerable attention in biomedical applications, which includes the tissue engineering nowadays, which is very interesting topic for the medical industries, and also that it is useful in the drug delivery and biosensor applications, owing to their excellent material properties. Now, that is why I take it as my honor to welcome Dr. Jayachandran Venkateshan sir. Please welcome sir, and we have the nice FDP on. Thank you
Yeah,
so much
thank
sir
you
for
so
coming here.
much. Yeah, thank you. Thank you so much for the great introduction about me. I let me share my presentation first. Is it my slides are visible? Fine, right?
Visible sir.
Yeah. Yeah, thank you. Thank you for inviting me for this faculty development program. I sincerely thanks to Dr. T.V. Reddy, Professor and the Vice Principal of the department, and he has introduced very nicely about the college and also the application of nanomaterial in different application, optical microscopy, tissue engineering, and drug delivery. And I also thanks Dr. K. Madhavi for the introduction about my brief introduction, professor in chemistry. So, and this FDP program definitely will be helpful to understand actually bio nanomaterials. First of all, actually, I am from chemistry background and I worked on both biological as well as chemistry. I hope that I will more focus on both chemistry as well as biology. And topic of my presentation is mostly covers on natural and synthetic biomaterials, and more towards I focus on tissue engineering and drug delivery and cancer therapeutics. And my name is Dr. J. Venkateshan. I am from Hyderabad University, Mangalore. So today I will be covering on different area of research, starting from history of biomaterials and what's the bone graft and the natural nano biomaterials. And there are the three different areas today I would like to cover: tissue engineering and drug delivery and green synthesis of of nanoparticles, and how to take the commercial perspective of these application into the real life application, whether it can be used for the human purpose. So those things we are going to see, and these are all my presentation outline. So come to biomaterials. What is the definition of biomaterials? Actually, the biomaterial, if you see that, it's a truly interdisciplinary field of research. It's need from the chemistry and physics, biology, and even material scientists, and even some bioengineers and biologists and computational scientists and immunologists and all surgeons. So these all people we need to combine together to develop any tissues. So by seeing the history of biomaterial, the biomaterial started almost 7,000 years before. And if you see the wood and leather, people have used very long before as wood and leather is very long before. That was like a 700 BC. The purpose of wood and leather, usually they go for war, and sometimes they lose their limbs or hand or even sometimes the full legs. So that time what they do it, they will just take some amount of wood and leather. They will make like similar like a wood, similar like a limb or similar like hand, but it looks like only cosmetic application, but it doesn't have any functions. Even they cannot even fold the fingers or limbs. But after some time later, the wood has usually it's by bacteria or any other organism usually disappear its quality, and also it's disintegrate, so that the people have developed the iron rod based. Even you can see this Peter Struent, even the leg is made up of the iron rod. So iron rod they have developed in 1672, but still it doesn't have any function. Even the person cannot walk or run faster, so it cannot replace the natural function of the bone. So after that, the people have come up with several other advantages, especially the gold and other 3D printing technology. The recent development, we can see that here the fracture, if the most of the time is post-menopausal condition, most of the women lose their hip because of the osteoporotic in natures. So that time we have to fix their legs using some implant. So this is what happening in 1950. So these are the recent advantages, recent advances in tissue engineering, and you can see that we can 3D print the organs. So this in 20th century, even if you lose any of the organs, we can 3D print it. Like you can see the fingers and we can hear. So this is more or like a 3D scaffold, we can print it out. So in Joseph Vacanti and another scientist, they have developed the ear model on the surface of the mice. So these are the advantages is going on in biomaterials. So why you really needed these biomaterials? There was an incident with one of my friend. He lost his both legs in one train accident. So still now he is using some kind of plastic based or Jaipur based legs. But the problem with that one, he cannot do many things. He cannot even walk fast, and even it's more like cosmetic applications. But using this tissue engineering or even biomedical application, we can recreate it, the whole leg, for his more or like looking like a natural legs. So this is the ultimate aim. But currently what we are actually in tissue engineering, most of the time is we used artificial skin, like for example burn skin or diabetic wound skin or even surgical skins. So those times we can use some artificially developed skin for the commercial application. So commercially, very few biomaterials are in the clinical levels. One is for artificial skin, the another one is artificial bone, and some of other like a stent, the heart wall stent, those are all in commercial materials. So to achieve these product is not only done by one person, we need to have the chemist. So the chemist is more or like to create that extracellular matrix. So they are the one knows about all the structures and the matrix about the scaffolding systems. So come to tissue engineering. So come to tissue engineering, how to develop any one scaffolding systems. The tissue engineering is the subfield of biomaterials and is truly interdisciplinary. And the main aim of this tissue engineering to to develop the organs or even the tissue to repair or restore or even the maintain the improve the tissue function partially or the old organs. So it's a subfield of biomaterials. I told there are several other application biomaterials also there. That one we are going to see in later on my presentations. So what's the basic paradigm? Like similar, like if you think about one computer engineering, there always deals about the assembly of parts like hardware and as well as softwares. So if you go for automobile engineering or even mechanical engineering or electrical and electronic engineering, so their aim is to develop any one like car or any other automobile constructions. Similar like tissue engineering also can develop any kind of organs or even any kind of tissues. The basic paradigm is this one is we have to start from A to E, and the A1 is, for example, if you want to develop any tissue, we have to take out the particular portion of the cells and then we have to isolate the cells. The first we have to take the biopsy and then isolate the cells, and then once we isolate the cells, for example, if you want to create the heart tissues, no, we cannot take only human heart, but if you want to create one skin tissue, we have to take out one small portion of the skin and then isolate the cells, and then we cultivate into billion of cells using the 2D cultures, and then once we culture into 2D cultures, so there is some process. So that process we call it tissue engineering. So it's involved the matrix as well as the growth factors we need to add, and the cells and the small molecules and nanoparticles. So once we combine this all the things together, so it create like a tissue like structures. So it causes the tissue organizations. Once the tissue organization happen, so it's become like a engineered tissues. Then we can make it out. We can make like a transplantation into the human body. So this whole process, we call it tissue engineering. So now we are going to see about the bone, where I extensively worked on. So where I worked on this bone graft substitutes. So why we want the bone graft substitute? There are the different condition of diseases, similar like periodontitis. Periodontitis usually happen in the tooth. It's usually the next to the tooth usually is lost it. So ultimately there is a chance to lose your tooth. And bone fractures and osteonecrosis, and sometime in the birth itself, some of the bones may not be correct, and tumor resections and motor accident and osteoporosis, arthritis. So these all the issues. We can create bone graft substitutes. There is any treatment options available in the market. Of course, we have the autograft and the allograft and synthetic grafts. So these autografts, we may know it. The autograft usually we take from the same person body, that is the bone is harvested from the hip bone, and we can re-implant it into the same persons. But
excuse me, sir.
Yes.
Slides are not visible.
Slides are not visible. 1 minute.
Yes.
Sir, here visible, sir.
Can you see?
Sir?
Yes.
Yeah. Visible.
Is visible, right? Existing solutions.
Yeah.
Right. The existing solutions are autograft and allograft and synthetic grafts. So this autograft is taking from the same person body, and allograft is from from the cadaver bones. So most of the people usually they die. So we can utilize those bones and we can store it in the biobank, and those bones we can use as a graft materials. But these graft have some issues, especially for non-osteoinductive and disease transmissions. These are the issue with autograft. So these are the drawbacks leads to develop the synthetic graft biomaterial, which is made up of tricalcium phosphate, hydroxyapatite, and bioactive glass. So these are the synthetic based biomaterials we can use for clinical applications. So, but these applications are non-osteoinductive and the leaching of biomaterial, and sometimes even the few milligrams is 5 almost 8,000 rupees, around $100. So we cannot afford it. So that's what we developed. I'm from Bioprocess Research Centers. So our aim is to develop best from the barren bio waste. So usually we eat fish and shrimp most oftenly, but most of the time we discard these fish bones as well as the shrimp shells. So it's ultimately sometimes it's give the environmental pollutions, but and also the raw material for the production of the scaffolding, since it will be very cheap, and also it's not only reducing the environmental pollution, and also we are developing the best biomaterial from the marine bio waste. So we can develop some kind of scaffolding systems, and then we can use for clinical applications. So we will see one by one how we can isolate biomaterial from fish bones. So the fabrication technology, there are the different kind of fabrication technologies there, like hydrogels, electrospun, or gas formed, or salt leaching method, and freeform fabrication, surface topography. So these are all the method we can design any kind of tissues. The 3D printing is more like if you want to like a nose-like structure, we can 3D printing it. So first we will see how the nanomaterial from the fish bones. The fish bone is major exporter or from Asian countries. So the most of the time the fish bones goes to waste, or they can use for the animal feeding again and again. So the first one is we use the two different methodology. First one is alkaline hydrolysis and the thermal calcination method, and we can see that here the peaks around 365 is it's because of the collagen moieties. But in the case of the A, B, and C, the collagen moiety is completely removed. And also the thermal calcination method and alkaline hydrolysis method to produce the carbonated hydroxyapatite. We can see it here 1455. This one we cannot see it in the synthetic biomaterials. That D1 is from sigma, is hydroxyapatite, but the C1 and the D1 and B1 is from it's from the fish bones, and we can see that all the structures are similar except this 455 and 417, which is different from the chemically synthesized hydroxyapatites. So this one having the more advantages in the bone formations. So further we check the phase and purity of the developed hydrolysis. We checked with the first of all is X-ray diffraction analysis, the B and the C. It's from thermal calcination and alkaline hydrolysis method, and D is the standard JCPDS data 09432, the standard, and we can see that the peaks almost equal to this standard peaks. That means that the isolated hydroxyapatites are very pure in nature, and also it's from microcrystals as well as the nanocrystals. And the two different methods is produce different kind of the crystals. We can see from our bone, this is actually fish bones, and the raw fish bones, it looks like a yellowish in color, and it's made up of collagen moieties as well as the nano hydroxyapatite combined together, and it's making very strong materials having 100 megapascal in unit. But using that different methodology, and we can see the nanocrystal in structures almost 20 nanometer in size, and the microcrystal structure is almost 1 micrometer in size. Then further we carried out the transmission electron microscopy to understand what is the exact crystal size. The crystal size showing that around 17 to 71 nanometers, and in the case of alkaline hydrolysis method to produce 0.3 to 1 micrometers. And the same thing, EDX results also confirm that the presence of hydroxyapatite with the defacing lines, and the EDX spectra suggested that the presence of calcium and phosphate and oxygen, and the calcium and phosphate with having 1.67 ratio. So further we check the biocompatibility of the developed microcrystals as well as the nanocrystals, which infers that the cell proliferations actually decreases with increasing the concentration of hydroxyapatite. But in even the very lower concentration, 1 day and 2nd day and 3rd day, is keep on the cell getting is proliferated, or even the growth is happening, but it's lower in the very high concentrations. But in the case of nanocrystals, it's having a better growth than compared to the microcrystals. Then the conclusion of this first work, so we have developed around 0.3 to 1 micrometer in size thermal calcination method and alkaline hydrolysis method to produce 17 to 71 nanometers. And the FTIR spectra suggested that the produced the carbonated hydroxyapatite and the developed hydroxyapatite showing similar index with the JCPDS data, Joint Commission Powder Diffraction Standard 090432 data, and it's very pure in nature. And these two methods can produce like microcrystals as well as the nanocrystals. Then what we have done it, we have developed some hydroxyapatite from the other resources also. So the most of the time the synthetic method we use for calcium nitrate and ammonium phosphate just mixed together and then is create like paste, like white color paste, and by increasing the temperatures and we can get hydroxyapatite products. The second one, most of the people you may see it, this cuttlefish bone. This cuttlefish bone, you might have seen it everywhere in the beaches, but most of the time it's like a sponge-like structures. So this cuttlefish bones having the excellent morphologies, it has like a layer by layer structures. And then this layer structure having the dorsal shield as laminaris shields. So we can directly cut it into the small pieces according to our size of the defect of the bone. We can cut it in the square size or round or whatever size we want it. The TEM and XOD results suggested that we can see the weight loss observed around 600 degrees Celsius. But in the case of the fish bone, you might have seen that there was a deflection point around 360 because that is made up of collagen. But this one doesn't have any collagen. This is only made up of the ceramic materials, that is aragonite. So the XRD suggested the presence of aragonite. And then, so this cuttlefish bone, first we have to make as a powder using the ball milling method, and then in the tripod, so we have to make with the cuttlefish bone and mixed with water, and we add with the diammonium hydrogen phosphate. So once we add this diammonium hydrogen phosphate, it's mixing with diammonium hydrogen phosphate and this cuttlefish bone powder and produce this like a nano hydroxyapatite nanorods, and then we can confirm the presence of TEM. And also we can see that the XOD results suggested that the presence of 32 degrees Celsius, it confirmed the formation of hydroxyapatite. And then, so as I told you, we can cut it into the any shapes. It depends on the defect, whether we can cut in the rectangle or square or even the dumbbell shapes or any other shapes we can cut. And then the person having the defect, and we implanted in that material into the particular specific place, and then we can do some radiographical analysis as well as histological analysis, and then we can get the results. So by confirming these results, we can use for the clinical application directly. And then the once we isolate nanohydroxyapatite as well as alkaline nanohydroxyapatite as well as the microapatite, and then we can mix with chitosans. Then we make two different kind of scaffold. One is chitosan microhydroxyapatite and the chitosan nanohydroxyapatite. And then this is the surface morphology of these scaffolds. And then further we evaluate the cell proliferations. The first cell proliferation we checked with mesenchymal stem cell with the different days, 1, 3rd, and 5th and 7th days, and we can see the cells are growing uniformly, like from the absorption value at 540.0 to 0.4 degrees Celsius, 0.4 absorbing unit. But if the growth is uniformly growing, then we find out this the biocompatible in nature. Then we move to the animal model. First we have taken the rabbit, and then we insert this material into this particular place. We cut the rabbit tibia first, and then we insert this particular place, and then we evaluate the radiographic analysis for 8 weeks, and we can see that this one is even 2 weeks is not forming anything. 4 weeks or even 6 weeks and even 8 weeks, it doesn't form anything. But in the case of small nanohydroxyapatite, and we can see in the 8 weeks there is some slight bone formation it's happening, but and also it takes some more time. even 12 weeks or even 16 weeks to take the bone formation even in the group B chitosan with the nano-hydroxyapatite. Then we move to the histological staining and microcity analysis, and here we can see the presence of chitosan as well as the hydroxyapatite presence in the developed scaffold area. But the hydroxyapatite is leaching out, but in the case of chitosan is trying to hold it. And then the histological staining suggested that the presence of re-epithelialization and also the bone forming. And the microcity parameters suggested that tubercular volume and bone volume and percent of bone volume is better than the group B. That is the nano-hydroxyapatite with chitosan is giving the better results compared to the group A. And then we develop this different kind of scaffolding system, more than 20 to 30 type of scaffolding system, because we want to develop the bone scaffolds. We need to mimic the natural properties of the bone. Then we move to improve the mechanical strength of the scaffold by adding carbon nanotubes. Carbon nanotube is considered as one of the very greatest materials. It's having strong mechanical strength ever made by the human. And so we added the different concentration of 25, 50, and 100. That's the low molecular weight chitosan, and high molecular weight chitosan we added 25, 50, and 100. And then we developed series of scaffolds. And then we checked with scanning electron microscopy, and we can see that the chitosan only is showing improper pore structures. But the addition of hydroxyapatite and multi-wall carbon nanotubes, and we can see the pores are uniform in nature, and also the dispersion of hydroxyapatite in the matrix is uniform in nature, and the size of the pore structures were 70 to 200 micrometer in size, and also 46 to 200 micrometer in size. So this micrometer in size is coherence with the natural bone. Then we check, because the carbon nanotube people say this is toxic in nature. Then we move to check the biocompatibility of the developed scaffold, and then we check with the OJ staining, and then we can see the blank, and then different kind of carbon nanotube addition, 25 milligram, 50 milligram, even 100 milligrams. And the cells are growing very good in terms of the scaffold. There is no toxic in nature. And then the mineralization were performed using with hydroxyapatite and ficodon composites. Then we can see that adipose derived mesenchymal stem cells shows better mineralization than compared to the we can see that red color. The red color increased the mineral formation than compared to only with the control system or even the blank system. The same thing, the OC and OP and RNX2 and collagen, its formation is increases by addition of the another osteoinductive factor like a ficodon, and then the similar like radiographical staining as well as the histological staining suggested that the addition of ficodon in the composites is increasing the bone mineral formations. So these are the scaffolding system. We have seen it for the long bone fractures. So most of the time in old people, you could have seen it, they always have issue with the cartilage defects, and they usually get pain, they usually cannot walk. Until now, there is people are using some steroids or even some analgesics to reduce the pain, but ultimate regeneration is not yet done. So we have developed some system that is made up of carbon nanotubes. The carbon nanotubes, it's first we functionalized with the nitric acid and sulfuric acid, just making the carboxylic acid in the side wall of the nanotubes, and then sulfonyl chloride and DMF we added. Then it makes acyl chloride. Then we are adding the addition of chito-oligosaccharide. We use a different kind of chito-oligosaccharides. One is 1 kDa, 1 to 3 kDa, and 310 kDa, and 500 kDa. So the molecular weight varies here. So we added, then it's combined with hydroxyapatites. So here you can see that these are the first one is carbon nanotubes. Second one is chito-oligosaccharide in different molecular weight, B, C, D, and then E and F is the low molecular weight and high molecular weight. And you can see the carbon nanotube is completely settled down. But when we functionalize with the carbon nanotube, it's not settling down, it's dispersed in nature. But in the overall period of time, around 7 days, is in the higher molecular weight, chitosan is trying to settle down, but in the case of very lower molecular weight, it's not settling down. So by addition of carbon nanotubes, chitosaccharide, that means a smaller molecular weight, is increasing the dispersibility, and can it be useful in the injectable form of cartilage regeneration? Then we characterized with a different chemical characterization. One is FTIR and scanning microscopy and biocompatibility, and we can see that the bones and the chitosan